Good morning, everybody. This is Dr. Bordolina. I'm an anesthesiologist at New York Presbyterian in Flushing, Queens, New York. Just giving you an update on the situation that we're dealing with here. I hope you can hear me. I'm wearing 2 masks and a face shield. The reason why I'm wearing this is because I'm in a unit with patients that have coronavirus. I'm in the labor and delivery unit, and there are proturians here who have coronavirus, unfortunately, and also those that are under investigation for coronavirus. They're sick, they're coughing, they're febrile, and they're here because they're in labor. I'm wearing an N95 as my primary mask and a regular surgical mask over that with a face shield. As you know, the supplies in New York are very low, and we are reusing our masks. What I'm doing is I'm changing my mask now because the mask I'm wearing is already wet, and I've worn it several days prior. So what I'm doing is putting on a new mask and saving my old mask, putting it into a paper bag, labeling the bag with the date, and rotating my masks to try to preserve them and get as much life out of them as possible. These rubber straps that hold the masks do stretch, and once they stretch, the mask does not have a good seal. If the mask doesn't have a good seal, it's pretty useless. The outer mask is here to protect my N95 respirator. These masks I discard once they're soiled, but again, try to conserve as much as possible. Once I walk into a labor room when the patient has COVID, I have to discard my protective equipment because it is at that point contaminated. And I can't go see other patients that don't have the virus with this equipment on. New York Presbyterian, along with many other hospitals, made a gut-wrenching decision to not allow any birthing partners in with the laboring patients. That means that these patients are delivering their babies without any close family member, without their spouses, without their loved ones nearby. I can imagine that it is extremely difficult for them. So we try to have as much compassion and support for these patients that are already going through so much as we possibly can. Our hospital has been hit hard. We have several hundred patients that are COVID positive or under investigation. We're intubating them by the dozens every day, unfortunately. We don't have enough ventilators to go around. We're talking about giving our operating room anesthesia machines that have ventilator functions over to the units that have these patients ventilated. It's a very trying time. We're doing the best we can. Please, we need your support. We appreciate your support. We're here for you. Please stay home for us to try to contain this virus.